All right, so hi everyone, and thank you for coming to our defense today. We are Project CARE, including myself, Jocelyn Lee, Alexander Moore, and Radhika Prabhune. Today we'll be presenting our project through which we co-created a preventative mental health resource grounded in the journey of individual resilience. So here's our agenda for today. We'll be introducing you to our problem space and our reasons for choosing it, and we'll then be going into our details regarding our project delivery as well as its implementation. So mental health was something that had personally affected each of us, and that was the reason we decided to work in this problem space. As graduate students ourselves, we know that graduate school does a great job of pushing our limits and challenging us to be the best versions of ourselves. But these pressures can also lead to exhaustion, stress, and low self-esteem. And in fact, this happens so often that things like burnout and imposter syndrome have actually become synonymous with the graduate experience. And so it came to no surprise when we learned that graduate students actually experience anxiety and depression at a rate 6 times higher than the general population. Thus, our team identified the need for students to be able to maintain their wellness throughout that course of graduate school.
So when thinking about mental health, there is a lot of different stages to this continuum, from having a healthy amount of stressors in your daily life to a crisis mode where symptoms of mental illness are becoming incredibly overwhelming. Now, looking deeper at the problem and the resources that were already available, we decided to focus on prevention because we found that the majority of resources were aimed to support students in the later stages, whereas preventative interventions helped with improving well-being through mental health literacy, which was allowing you to recognize your own warning signs and maintain an overall wellness. So this is where resilience comes in, the dynamic ability to adapt to these overwhelming experiences. It encompasses the main ideas we want to promote, like self-care, self-awareness, seeking help, and finding social connectedness, while also effectively contributing to a general well-being, even counteracting mental health issues in an upstream and preventative context. Now, translational research is well suited to tackle this problem because it focuses on the implementation and action to bridge the gap between researchers and the community to really make a difference. We worked with experts in many different fields surrounding mental health and prioritized graduate student involvement to better understand the needs and gaps in this area. This project's goal is to push the ideas and understandings that we've gathered into tangible actions and make a meaningful impact to graduate students.
So in order to achieve these goals, we worked through 5 distinct phases. The first was our environmental scan, where we investigated resilience education strategies and best practices in preventative mental health in different contexts. We did this through literature review, resource analysis, and expert consultation. We then moved into our needs analysis phase, where we explored the concept of resilience in the context of graduate school. We also wanted to identify major needs and barriers in mental health resource accessibility, and we did this using graduate focus groups. We then moved into our resource co-creation phase, where we collaboratively developed a tailored mental health resource grounded in the journey of individual resilience for graduate students and in partnership with a student advisory committee. We then tested this resource by collecting feedback and suggestions for improvement for the proposed resource concept from expert opinions, that student advisory committee, and a new set of concept testing focus groups. We then went into implementation, where we delivered that revised resource to the University of Toronto Health and Wellness Division, who we are formally partnered with, and established other partnerships necessary for its implementation to the student body in the fall semester of this year.
So our first phase was an environmental scan, so we could better understand the landscape of resilience, both in terms of how it's applied today and the academic understanding. In our literature review, we looked at multiple resilience frameworks and measures, ultimately deciding that the trait resilience framework best suited our purposes. We analyzed more than 30 different resources and options to understand the possibilities that exist in this landscape, even including things like artificial intelligence. We also looked at different contexts and applications of resilience in multiple spaces, like higher education, workplaces, and healthcare settings, to understand what other institutions were doing, like McMaster and McGill's mental health groups, or Stanford's online class, The Science of Wellbeing, by Laurie Santos. We also consulted with many experts, both locally and internationally, such as experts on resilience in graduate education from our own campus, and experts in positive psychology, including Her Royal Highness, Dr. Gabriel Oettingen from NYU. Once we had a solid ground underneath us from our environmental scan and our REB was approved, we recruited graduate students from the University of Toronto for focus groups for our second phase, the needs analysis. We used focus groups because we wanted to gather insights directly from student experiences and give students a chance to share their stories, fitting with the interpretive narrative framework that we used. We wanted to answer 3 questions in our focus groups shown here. What is the student perspective on resilience and how does it manifest throughout their journey in graduate school? What factors contribute to changes in mental health and resilience among graduate students? And what is needed from current and future mental health resources? We took the transcripts from our focus groups, cleaned by our research assistants, and set out to make meaning. Our data coding followed guidance from qualitative methods specialist Johnny Saldana. Initially, we assigned tentative open codes to each transcript line simultaneously, using a line-by-line open coding approach, generating more than 200 codes. These codes were then reviewed, refined, and adjusted as needed, with a decision journal tracking the process. Codes were categorized and connected using axial coding, leading to the formation of broader research themes. Themes were grouped based on relevance to 2 broad sections: resilience in mental health in graduate school and resource considerations. Now, what we found surprised us. Graduate students said that resilience was a positive trait, and their stories made clear that they were already actively developing resilience and reflecting on what it meant for them. This quote is from one of our focus group participants. Is resilience really just pushing through things mindlessly and then hoping something comes out of it? Or is resilience that reflection of where I am and what I need to do to be better while taking care of myself? We had asked participants what resilience meant to them and about times where they had felt resilience. And looking over these stories and the codes again and again, a pattern emerged which turned into this model, which we have called the resilience journey. It reflects something that we didn't expect, which is that graduate students don't need to be taught resilience. They're already developing it themselves. How? Well, this journey describes a change or a problem that precipitates the effortful experiences and striving that graduate students told us was where they developed their resilience. But this development was impacted by a number of positive and negative influencers, like availability of social supports or negative environments, which determined if they would grow or be damaged by their experiences. Eventually, each challenge they described ended, but this was never really the end, as problems evolved and new challenges appear, starting the cycle again, influenced by the results of previous cycles. This novel finding of how graduate students develop resilience changed our perspectives on how we could create a resource that would be truly helpful for graduate students.
Now, the second half of our focus groups discussed resource considerations. What was their ideal mental health resource? What did they currently use for their own mental health? What was needed from the resources that the university already provided? Our focus groups described their own experiences coping with stress, both from graduate school and outside of it. They talked about developing their own outlets like working out, going for walks, or taking time for their own hobbies. They also discussed their own experiences while using external resources, like how professional help was expensive to the point of creating new stressors. Students highlighted the importance of connection and support systems. These were the factors that saved them from their heavier days. However, they also spoke about the difficulties they had navigating university resources. Participants had heard here and there about different resources that other people used, but when actually trying to find them themselves, they felt that they got lost in the endless stream of links or dead, unupdated websites. These highlights showed us that mental health wellness was maintained in so many different ways, but having support while finding your own way was crucial. So this leads us to phase 3, a resource co-creation. Involving graduate students in the development of this resource was an important focus of ours, so we recruited 8 graduate students from the Temerity Faculty of Medicine to form our Student Advisory Committee, or the SAC. So with our SAC, we validated our main findings, then ideated and prototyped our resource. The first question we had for them was, did our findings and analyses resonate with them? And the answer was a resounding yes. And they also provided us with some very insightful additions. We then used a combination of synchronous and asynchronous methods to ideate and then prototype a resource. So in the ideation session, we took those focus group questions that were focused on understanding, and we altered them to action-based questions about our resource. From learning about resilience in graduate student lives, we asked, how might the resource promote and foster resilience? From factors contributing to mental health and well-being and resilience, we asked, how might the resource help minimize these negative contributors and maximize the positive ones? Finally, after learning about the needs in resources, we asked, how can we make the resource relevant and accessible to graduate students? Now, these questions were discussed in our first ideation session, followed by a rapid brainstorming on how these ideas could come to pass. Now, not all of our SAC members were able to join our meetings, so asynchronous surveys were used during this entire process to ensure that everyone was given a chance to share their opinions, and each survey was continued through the discussion process once we reached our prototyping session.
So after our ideation session and surveys, we had a good idea of what we wanted to create, a resource that would foster connection and allow students to know what resources are available to them. We then held a synchronous online prototyping session with our student advisors and a representative from Health and Wellness, where we went through a series of targeted brainstorming questions and dot voting. A lot of concepts and features came out of this session. This slide shows a simplified example of one of the 7 different question prompts that we used. We started by generating 6 different resource concepts. Our dot voting approach allowed us to rapidly select a single idea and then move forward to establishing desired features, like how the resource would accomplish its aims, who should be involved, and what to avoid. Dot voting worked very well for establishing feature preferences, as it provided a heat map within the suggested features that clearly pointed out what we should focus on. And at the end of a 2-hour session, we had a clear blueprint to move forward with for our prototype.
And so together with the recommendations from the SAC and the resilience journey in mind, we developed the grad guidebook that was geared towards 1, equipping students with the supports and tools needed to navigate the negative influencers of resilience, and 2, highlighting strategies of amplifying positive influencers. Our findings indicated that the existence of some important positive influencers can dramatically offset the opposing ones. So for example, access to appropriate insurance and funding information can help to offset financial burdens. In short, we made the guidebook to help ensure that access points to the most important, valuable, and highly desired existing supports on campus were available and obvious to students. So our team created multiple versions of the resource ourselves to accommodate as many recommendations from the SAC as we could. We emphasized simplicity and accessibility and designed it for both virtual and in-person use. We included additional sections like financial advice, social activities, and personalized features. Notably, we introduced a unique passport system where students can collect stamps by participating in wellness events and checking in at specific places. This system aims to motivate engagement by allowing students to redeem stamps for campus rewards. After refining our prototype, we presented it to a second set of focus groups for concept testing. Which brings us to phase 4, where the concept testing groups assessed the resource's strengths and weaknesses, considering its feasibility, viability, and desirability. Overall, students found the guidebook easy to navigate and versatile. They appreciated its broader range of resources beyond mental health. Many were also interested in the passport system, but concerns were raised about its implementation and maintenance, as well as the lack of virtual rewards. Suggestions for improved accessibility included compatibility with screen readers and tailored financial information specifically for international students. Notably, the idea of charging a fee for the guidebook was strongly discouraged. And so taking this feedback into account, we revised and finalized the Graduate Wellness Guidebook set for free distribution in the upcoming fall 2023 semester. This collaboratively developed resource directly addresses the concerns raised by graduate students in our research and highlights existing supports that they indicated as desirable. It meets them at various points in their resilience journeys, offering ways to make the most of graduate school, find community support, and navigate challenges. You can check out the most updated version on our website by scanning this QR code here, and don't worry if you miss it, we will be posting it again later on in the presentation. And so the Graduate Wellness Guidebook was created to address the difficulties students face in accessing wellness support during graduate school. And while other centralized resources exist, like the Essential Guide for Grad Students and the Grad Hub website, students noted that they often struggled with navigating these platforms and felt overwhelmed by the abundance of information they were receiving at once. Our guidebook takes a different approach by providing a concise overview of service providers, making it easier for students to quickly see available supports and visit the provider's website accordingly. This design minimizes the need for constant updates, as service providers are responsible for maintaining their own information. Additionally, the guidebook covers not only wellness services, but also social events, insurance details, affordable healthcare providers, and our unique passport system. Early feedback indicates that the guidebook effectively offers a focused view of professional health, community events, and diverse options tailored to the holistic graduate experience.
So with our main goal being to make this guidebook available to an already diverse population, we had to think of many different dissemination strategies to get this into the hands of graduate students. Firstly, the guidebook requires support from the university itself. Having these campus partnerships can help us reach out to more students and also promote different services around the campus to offer. Now, we've also started this process by establishing a strong connection with the University of Toronto's Health and Wellness and their health promotions team. In addition to that, a show of support from supervisors, PIs, and professors will not only help with the dissemination, but also provide graduate students with the feeling of security when it comes to being vulnerable and working on their mental health balance. We are also very happy to note that we are going to be presenting this guidebook at the School of Graduate Studies orientation this September with the Center for Graduate Professional Development. This event is going to help us unveil the guidebook and other promotional material for Project CARE to over 250 graduate students. And at this event, we are also going to be able to present our project sustainability strategy. The Project CARE Student Alliance, or the PCSA. This alliance is not only going to be able to help us carry on the mandate of Project CARE, but it's also going to help us advocate for graduate students by liaising with the many different departments at UofT and keep the guidebook up to date with resource knowledge as it develops with the university.
And with that, we present an updated message of Project CARE: connection, advocacy, resilience, and empowerment. And we look forward to working with our partners at Student Life, Health and Wellness, the University of Toronto Graduate Students Union, and the Center for Graduate Professional Development, as well as the Translational Research Program, to bring this resource to graduate students at the University of Toronto. And we want to say a big thank you to everyone who has supported us: our participants, our supervisors, our advisors, our student advisors, the project assistants, health and wellness, the experts we've consulted, our peers, and all the other people along the way. We truly couldn't have done this without your assistance. So thank you all very, very much.
And so in case you missed it, here's a summary of our project. So Project CARE worked directly with graduate students to conceptualize the journey of individual resilience in higher education and identify major mental health needs and resource barriers. We then co-created the University of Toronto's first wellness guidebook tailored specifically for the graduate population, which has received initial graduate student feedback and will be ready to be distributed in the fall semester of 2023. In case you missed it as well, you can scan that QR code. It'll take you to our website where you can not only see and download the most updated version of our guidebook, but you can also check out our latest updates on our team and project as we continue to move forward with our initiatives. And we thank you for listening.